CADCA touches all populations. They touch kids, which is a big part of prevention. They touch community leaders. They touch businesses and schools. More importantly, they touch federal policymakers. And they touch folks like ourselves to help us understand a little bit about how communities might need to approach prevention efforts.
CADCA is a wonderful organization that sort of brings together the expertise and the wherewithal to help communities realize that the solutions are there. If the only people who know what the coalition's doing is the people on the coalition can't be effective. So they offer technical assistance, they offer advice and guidance, they offer a perspective about how to, again, identify the solutions and then realize them within those communities.
We need to reach everyone from a parent to a young person to a school to a business, and CADCA has a terrific training institute that goes state to state, community to community to help spread the word.
A short 15 years ago, I met General Dean at the CADCA forum down in DC, at which point he was willing to open up the mic and ask what CADCA can do for the communities. I took the opportunity to speak up and say, CADCA, I need your help. You need to provide us training, you need to provide us means to funding and access to those funds. He listened, and that generates interest in the field for the future. And that's the change, where the rubber meets the road. We need youth involved with prevention, and by opening those doors for those opportunities, we're sealing a better tomorrow for all of us.
So my brothers came home from school one day. They told me about the contest, and I was up for the challenge.
I'm just smoking. This is job for the captain. Huh? I'm Captain Butter. I'm here to tell you tobacco is bad for your health.
Well, I wanted to inspire people to not take drugs, and I thought it would be a challenge.
The most influential way to get a message out is through your friends, and if friends saw the video, they would spread the word.
Tobacco, if you're in it, quit it. If you're not, be smart, don't start.
Our youth know what's going on. They know how to address it to make changes, and they have passion. They have that energy that sparks energy in everyone else.
Under CADCA's leadership and support for our community coalition, we have been able to bring youth, many youth to the table, and this has certainly brought the ability for adults in our community to see the need for listening to youth, and has also given opportunity for the youth to build their leadership skills.
I am here to challenge each and every one of you to go back into your communities and to empower adults and youth alike with the knowledge that underage drinking is not acceptable, it's preventable, and it can and will be done.
CADCA and SAMHSA do a lot of work together, and most importantly, they provide a voice sometimes for programs that we fund. We think prevention's time is now. We think that substance abuse prevention is really going to take off. Substance abuse can be prevented, it can be treated, and people do recover. So we really appreciate the partnership with CADCA in making that happen.
With CADCA's support, we've been able to reach more communities faster, and they have helped us reach all the members of a community, meaning all the different parts.
There is no health without mental health, and that's one of the things that CADCA is helping us achieve. That conversation about the fact that it is important to address mental health for everyone.
CADCA has played a critical role in bringing the larger community into the discussion about the importance of substance abuse treatment.
CADCA has been great as far as raising the awareness in the country of coalitions and the work that coalitions can do.
I think CADCA is very instrumental in providing at a national level the kind of support, and when you have that kind of national validation for community collaboration, it makes people a lot more willing to sometimes reach out and work across systems. So we love CADCA.
As an organization, CADCA has taught me how to build relationships in the community. I think that it has made our coalition a lot stronger, more visible, and certainly has increased our the trust level within the community.
Underage drinking tip line, how may I help you? CADCA is like having a team of experts right at your fingertips. They're literally on the speed dial on my phone. They've provided me multiple levels of technical assistance, having to do with coalition management, having to do with sector engagement, and I get that either through email, via the telephone, or at our trainings periodically throughout the year.
Want to look at 2020 and just see if it matches. That too, or set aside something. We're not now.
I think we're at a stopping point, so let me just say, I have just seen an incredible application of the 7 strategies for community change and involvement around environmental prevention strategies. And CADCA has done a wonderful job of putting this together in a book, and you guys did it perfectly. Thank you. And aren't we glad that CADCA did all that work for us? I had an opportunity to attend the CADCA Academy, 3 weeks of very intensive learning. And the best way I can summarize that is simply, it doesn't cost a dime, but you get back a ton of change.
CADCA is reach. And what I mean by that is when we need to get a message out, or when CADCA needs to get a message out, they are instantly reaching to parents, kids, communities. They are the boots on the ground across the country.
Welcome to Washington, D.C.
Thank you, CADCA, for having the energy and the persistence and the wisdom to know how to speak for us on Capitol Hill.
Thank you, CADCA, for your resources.
Thank you, CADCA, for providing us with the knowledge and support to carry on our mission.
Thank you, CADCA, simply for making our jobs easier to do.
Thank you, CADCA, for mobilizing community interest in alcohol and drug abuse prevention and treatment.
Thank you very much, CADCA, for your tremendous involvement and for your tremendous power and for your tremendous leadership to help us move America forward and look at a very broad promotion and prevention agenda.
On behalf of the Center of Substance Abuse Prevention, I would like to thank CADCA, and particularly General Dean, for his leadership and his ability to look into the future and know what we need to have healthy and safe lives, healthy and safer communities for our children to grow, for our adults to flourish.
General Dean, I want to thank you for your wonderful leadership of CADCA, and quite frankly, the success of SAMHSA would not be what it is without the wonderful work that you and the staff at CADCA do. Thanks very much.
Thank you, CADCA, for your work with SAMHSA and for your work in prevention in America's communities.